Hi, we're here with Gary McDaniel. He is a therapist here at Atlas Psychiatry. We're going to have a friendly chat about our work together and his work here. Gary, welcome. Happy Friday.
Thank you, Dr. Pejic.
Yep. So it's the weekend before Christmas coming up here. We're in a festive. We have a Christmas party today. Tonight it'd be fun. Are you
looking forward to it?
You're looking forward to it?
Yeah. I'll tell you what though, I had a little dilemma.
What's that?
I ordered a Christmas shirt.
Yeah.
Didn't come.
Oh man.
I was afraid it wasn't going to. I ordered a backup Christmas shirt. It came and it was like an extra large kids shirt.
Oh,
so I couldn't get my arm in the arm. You know? So
that's too bad. You need to like Incredible Hulk it, you know what I mean? Where you cut the bridges, show off the pipes, you know what I mean? Like, or the guns.
Yeah.
That's great. What's on the shirt?
Well, it llamas with Christmas hats.
That's great. That's great.
The early one I ordered were narwhals.
The narwhals, yeah.
But the horn was a candy cane.
Yeah, I think they used the narwhal motif in Elf, the Will Ferrell movie.
Yes,
they had
that's right.
Borrow upon the 1960s claymation one or something.
I had forgotten about that. Yeah. You're right.
Well, so tell me, let's talk about therapy. So Gary's a therapist, and Gary, tell me, how did you get into becoming a therapist?
Yeah, so I think it really goes back to, and you and I had an earlier conversation about this, but it goes back to a high school guidance counselor that I had, who I don't think I would have graduated high school if it wasn't for Joan Kukin, what's your name? And I certainly wouldn't have gone to college, but she was just a terrific high school guidance counselor, and that was really my first connection to that. And I think I felt a real sense of gratitude, and you know, as I went through life, I got to a place when I started to mature as a human being where I wanted to give something back. I wanted to do for other people what had been done for me. So that's what really attracted me to it initially. And then I went to work for an organization called SOME, So Others Might Eat, which is a Catholic charities organization in Washington, D.C. that started feeding homeless people, but then they started to ask like, yeah, but what's the root cause of this? So they started doing addiction treatment and mental health treatment and medical care. And when I was working there, I worked with a wonderful woman by the name of Sister Elena Henderson, who was had her MSW, was a great psychotherapist. She also had a Master's of Science in Nursing, and she was also had a black belt in Tai Chi.
Oh wow!
She was just a really great lady, and she would talk about clinical social work specifically as you know, the person in the environment and the importance of looking at both of those things. And it just seemed to me like a great way of, you know, being involved with people in a helpful and healing way. So I went and got my master's in social work and been doing the work ever since.
When you got your master's in social work, or how did you specialize beyond that then, and kind of what kind of work did you do throughout your career up until this point?
Yeah, so I really like psychotherapeutic models. So I've continued to train in different models. First model I trained in was called Pest Avoidance System Psychomotor, and then when I was in college I started learning about cognitive behavioral therapy and brief solution focused therapy and the different family therapies, structural family therapy, and all those different modalities. And I just really fell in love with the way theory and practice comes together. So that's a piece that I've always really liked. I like taking those, you know, theoretically grounded approaches and operationalizing them so that they actually work for real people.
And what do you see when families come to us and then to you for family therapy? Tell me a little bit about what you see causing family problems, especially as we're going into the holiday season here and families are all going to be getting together.
The fundamental problem that I always see is that when someone comes into family therapy, it's like one partner thinks you're the problem and the other partner thinks you're the problem. So everybody's working on the other person, which of course never works, because all we can really work on is ourselves.
Yeah.
Or in a family, there will be a child that, well, we're here to fix this kid. We're all fine.
Yeah.
This is the identified patient. So really the first step in family therapy is just getting everyone to take responsibility. because for a family to work really well, everybody has to be functioning really well.
And when you do that, is it pretty intense in
Yes.
the sessions? Yeah.
Yeah, people get upset
And
until they get past that. And once they get past it, then they start to really see the benefit. And then you can really start to work on things like communication skills, collective problem solving,
yeah,
logistics, scheduling. Sometimes there's really some lovely low-hanging fruit, right? Sometimes there's some really easy things that can help to move the family forward in a much better way. But what it almost always gets down to is each member of the family has to learn to self-regulate,
yeah,
and they have to learn to help their partners co-regulate.
okay,
If everyone's well emotionally regulated, then we can solve all kinds of problems. If one of us is emotionally dysregulated,
yeah,
we're not going to solve anything. We're just going to beat each other up.
yeah,
We're just going to bring out the grocery list of all the past wrongs, and we're going to
yeah,
rehearse all those, and I'm going to tell you why you need to change and why it's your fault, and you're going to tell me why I don't understand. And that's just a never-ending loop that gets us nowhere.
And how many sessions does it usually take a family, in this example, to make some changes, some meaningful changes?
I try to get meaningful change on the first session.
Okay, wow.
So, and once again, that's where that low-hanging fruit comes in.
Yeah,
If you can really take time to get to know each member of the family, as I'm getting to know each member, really listening, really tuning in, then the other members of the family are also listening and tuning in.
and
So they're starting the same process. And if I can really figure out everyone at least a little bit, we can often find some solution that's pretty simple that creates progress, because success breeds success. So we're looking for the behavioral momentum. If we can get a little bit of momentum out of that first one, then people will keep coming back.
And what's the longest amount? How many sessions would be the typical course of family therapy in general?
Families are more alike than different, but I'm not willing to say that there's a typical family, because everyone's circumstances are quite different. But sometimes as few as 3 or 4 sessions can get people back on track. Sometimes you've got a real rebuild, and it could be a dozen,
10,
15.
15 sessions, sure.
Yeah.
So for patients listening, or potential patients listening, why would they come see a guy like you, and how would you help them, do you think? It's a general question, but
Yeah, well, when you're in the family, it's hard to see the family, right? So by coming to an outside party, they're going to get a perspective on family that they're just not getting. They're running around the same loop over and over again. It's called a closed system, right? So when you, just by virtue of opening the system up, right, you're going to get a different perspective.
Right.
Families often have unwritten rules like don't talk, don't trust, don't feel. So when they make a choice to come to family therapy, they're making a choice to talk, to trust, to feel. That in itself changes things. And then you add the outside perspective. I can see the family much more clearly than they can see the family. Just like I can see you right now more clearly than you can see you.
Right.
Right? Even if you look in a mirror, you're not really seeing you.
Right.
Right? So there's value to that. And then there's the fact that I just bring skill to the game.
Yeah.
I've been doing this a long time. I've studied a number of different structural family therapies. I know some things about how to pay attention to how power moves in the family.
Yeah.
Right?
Yeah.
Who speaks for whom? Who gives whom permission to speak?
Yeah.
Right? All those kind of power dynamics. I'm just over the years of experience, I'm good at paying attention to how the communication flows.
And when it comes to individuals, when you're just working with an individual, what type of work do you do one-on-one, not just with the family, but in one-on-one circumstances?
If I'm working with the person individually, once again, it depends on what they're there for.
Yeah.
First and foremost, when someone brings a presenting problem to me, my obligation is to help them with that presenting problem, right? Now, I may be aware that someone really has 3 kind of big problems.
Yeah.
But if they came to me for that one, we're going to solve that one.
Yeah.
And if we can do that in 3 sessions, we're going to do it in 3 sessions.
Okay.
Now, if they want, they can re-up and say, okay, now I want to work on this next thing.
Right.
And sometimes people do, but sometimes people really just want to resolve that one issue.
So it's just a solution for kind of brief-oriented therapy, solution-based versus
Right.
like this extended one. A lot of our patients
That's right.
will balk at the idea of doing therapy because they think it's, they do
Forever
it
and
forever and ever. So I really appreciate you saying that and that you have that approach.
For instance, if you come to me just because you're not sleeping well,
Yeah.
well, let's just address that.
Yeah.
That might fix everything else.
Right.
Right? So we teach them sleep hygiene strategies, and we teach them emotional regulation strategies.
Yeah.
And if that does the trick, great, we're good. And if we leave it in a really positive, productive place, then that person also knows, if I hit another snag, I know what to do.
Right.
I can come right on back and work through that next thing.
What do you like most about being a therapist?
Watching people grow.
Yeah.
Watching people improve their game. Watching people, in the context of family, watching a family that's falling apart start to fall in love again.
Yeah.
That's amazing.
Yeah.
Right? Seeing people start to reach goals. Seeing people go to school. Seeing people, start taking care of themselves.
Right,
Seeing
right,
people.
right.
I love that. I love that process of growth.
Yeah.
I love that. I kind of like to win.
Right.
You know?
Right.
And when the patient I'm working with is winning, that's me winning too.
Yeah.
And it feels really good to watch people grow and succeed.
And going into the holiday season, do you have any tips for individuals or families for this next week or so? Just kind of curious if any tip for dealing with each other.
Yeah, I a couple things. One, the most fundamental unit of life is a breath, right? And there's this cool thing about when we breathe in, it stimulates our sympathetic nervous system, which is kind of like hitting the gas a little bit. And when we breathe out, it's hitting our parasympathetic nervous system, which is kind of like hitting the brakes a little bit.
Yeah.
So one of the first things I usually like to teach people at any stressful time is to breathe in on a 4 count and really fill up our belly, right? So we're breathing it, doing a nice belly breath. Breathe in on a 4 count, and then breathe out on an 8 count.
So if they're having trouble family-wise or going into these situations,
if they can tap the brakes a little more than the gas, it will help them to stay regulated.
Right.
If they can stay regulated, it's going to be easier to be with their family.
Right.
The other thing I think is really important is for people to learn to pay attention not just to the content of what people are saying, but to the process of how they're saying it, right? So sometimes we get stuck in the words. No, it wasn't 5:30, it was 5 o'clock. No, it wasn't 3, it was 7, we get in those details and we get kind of lost in the woods.
Yeah.
What I think helps is to pay attention to more like what people are experiencing and how they're connecting. So if I'm sitting in a room with my family and they're talking about something politically or emotionally or religion-wise or current events-wise that is uncomfortable for me, I could get stuck in the words and have a debate about that, whatever, which would make everyone anxious.
Yeah.
Or I could just notice that they're feeling kind of out of place, and they're uncomfortable, and they're overcompensating.
Right.
And I could just pay attention to that aspect of it. And now maybe I can offer something that would help.
Yeah.
Now maybe I could say, hey, let's go get a beverage.
That's right.
Right.
What about you personally going into the new year? Do you ever assess where you are and what you're doing personally?
Yes.
And do you, like many other people do, use the new year as a metric, or are you?
I do.
Yeah. And
I
what's your
think
process for that? I'm just kind of curious.
Yeah, I think it's kind of a natural human process to like mark special events, whether it's the new year or my new year on my birthday or whatever, but those kind of passages. So typically I make a New Year's resolution, which I don't keep. That's usually my process. But one thing that I do always try to do, which I think is super important, is when I'm with my family, I'll just say like, what do you want to accomplish this year?
Yeah.
And it's not so much even that we're doing like realistic goal setting, because there's a lot more to goal setting than just I want to lose 30 pounds.
Yeah, sure,
right?
Sure.
But it's the fact that it gives us an opportunity to tune up, to what one another's wants and needs and desires are,
Yeah.
what we're feeling not great about, what we're feeling hopeful about.
Yeah.
Instead of like, this is my resolution, I'm going to change this thing about me, I like to think more about like, what are you looking forward to this year?
And
What's exciting about this coming year?
What about for you? What do you like to do when you're not being a therapist?
Since I moved to New Orleans, eat. which is part of my New Year's resolution to change my relationship with the food in New Orleans because it's fabulous.
Where do you like to
go?
go?
Before moving to New Orleans,
that's
really my favorite thing everywhere I go is to get in the water somehow. I like to canoe.
No, I mean, what restaurants do you like to go?
Oh, what restaurants I like to go to? Oh my God, there's so many. My wife and I ate at Shia the other night.
Oh yeah,
that was phenomenal. They had this hummus with this local little mushroom medley in it.
Yes,
it was to die for.
Mm-hmm.
Yeah, and there's the little place that you told me about, Lillette, right across from the office. And, and the Muscovy duck there was
the duck is good there. I like it.
But our favorite place is Louis, which is a little Asian inspired place. It's
also a magazine?
No, it's on Choptulas.
Okay, Choptulas.
Choptulas. Achfalaya is a favorite.
Oh yeah.
It's fantastic, but my goodness, it almost seems like there's no bad food in New Orleans. I guess like they don't last if they're not good.
No, exactly.
Yeah, it's from like, little, there are also some little places just kind of near where we live that are kind of we just walk there because it's half a block away places. And there's a Japanese place, and there's a Vietnamese place, and there's a Mexican place, and there's a Greek place, all like within a block.
Well, I think it's great that you've really enjoyed that part of it. I enjoy that part too. I think a lot of people who stay and live and stay here in spite of all the storms and whatnot, I appreciate that. So, well, thanks for chatting with me today.
Absolutely.
Appreciate that you're part of our team, and we hope that you have a blessed new year.
Thank you. It is a great team to be a part of, and let's do this again sometime.
Absolutely.
Yeah. Merry Christmas.
Merry Christmas.
Happy New Year.
Happy New Year.